Hello, this is Kelly Miners, and this is my NU 6213 Curriculum Design and Teaching Strategies Final. For this final, we are to do a concept map, and we are to pick a topic in the 2030 Healthy People Initiative. And I went to that website and looked at that, and the disease process in which I wanted to implement into curriculum is diabetes. And I chose that because that's that seems to be a common disease that many adults have in today's world, and I see it a lot in the acute care setting. I thought it would be part of a medical surgical care course for a undergraduate bachelor's in nursing curriculum. So like I said, I chose diabetes, and the course that I find it to be filled into the curriculum is a medical and surgical care class. And the objectives that I think are the most important for this topic are that by the end of the unit, the student will be able to, number one, describe the use of informatics and technological advances to correspond with and support clinical decision making as it applies to med-surg patients. The second objective is by the end of the unit, the student will be able to demonstrate clinical decision making skills to show ability to critically think, analyze clinical problems, and strategically plan appropriate interventions consistent with the BSN's scope of practice. And the third objective is by the end of the unit, the student will be able to manage the nursing process, including patient assessment, plan, implement, and evaluation of care for medical surgical patients. So I chose these three different objectives to try and give the student a thorough set of concepts and goals in order to take care of patients that have had a diabetes history or diabetes in their health history. So that's the beginning of why and the course objectives and why I chose diabetes. So now we're going to go into the Aacn Essentials of what this vision of this curriculum plan would include. So the three Aacn Essentials that I thought were important for this module would be the information management of application of patient care technology. So the way that I see this working is the student would obtain patient data via EMR, state the importance of a hemoglobin A1C, use diabetes education box to perform initial diabetes education to the patient, including importance of labs. And that would cover objective 1 with describing the use of informatics and technology advances to correspond with support clinical decision making as it applies to med-surg patients. So that would encompass that kind of concept. So they start to use the different resources and the different technology to find these resources to help assess a patient with diabetes. The second Aacn essential is quality and safety. So what I see how this unit would encompass this is understanding disease processes, medications, and how these affect the patient, health prevention and promotion, and anticipating the needs of a diabetic patient. So this would look into objective 2 by encompassing the clinical making decision skills. So if one can understand the process of diabetes and the disease process and what kind of things that your patient would need to do to help with health prevention and health promotion, then this would cover that objective to help make better informed clinical decisions when taking care of these patients and analyzing clinical problems and planning appropriate interventions in order to thoroughly care for your patient. The third essential that I chose for the Aacn Essentials is system-based practice. And the way that one would integrate this into the curriculum is how to integrate pharmacy, social work, case management, the diabetes educator, all of those different multidisciplinary teams into the patient's care to give them a system approach to maintenance and disease prevention. And that would help encompass the objective number 3 from the course by managing the nursing process, including patient assessment plan, implementation, and evaluation of care for medical surgical patients. So if one can understand all of these different disease processes, how it works, how diabetes affects the patient as a whole, and the resources they need to implement and come up with interventions to care for the patient, that would kind of help carry that concept through. Next, we're going to move on to the QSCN competencies. And the two that I chose for this curriculum design is patient-centered care and safety. So the way patient-centered care would be used in the diabetes module is for the evaluation of the patient's resources, labs, ideas, and thoughts on having diabetes and diabetes care, which would kind of correlate with objective 2. The way that this incorporates objective 2 is that you are assessing and critically thinking through the patient's resources, looking through their labs, analyzing their labs, seeing if there is a difference in that hemoglobin A1C or any other labs, if you're following kidney function test or anything like that, and being able to utilize that multidisciplinary team, help plan interventions, and help provide patient with the resources so that they can help manage their own care once they're out of the hospital. And the second QSEN competency is safety. So safety would be used to correctly identify means to ensure correct lab, medication, and other interventions are being used to prevent error. Education to the patient on signs and symptoms of hyper or hypoglycemia and correct interventions needed if the patient is in fact hyper or hypoglycemic. Utilize the resources to guide cares, interventions, and procedures. So this would help to integrate objective number 1 from the class with use of informatics and technology. So technology would be your EMR, you'd be going through those lab resources, you'd be going through maybe some of the core process with drawing labs, making sure that you're sending the right patient, the right labs, at the right times down to lab, and using that knowledge that you have gained and what are the signs of hyper and hypoglycemia and what are the interventions that the patient needs to know, or what do your orders say in order to take care of these patients. And this will kind of help with the concept of using your resources, following the orders, by trying to work through the process of diabetes. So the final modality in which we're going to look at with diabetes in this curriculum design is the NCSBN. And with the planning of the NCLEX 2019, what kind of things are going to be into this exam that the student will really need to be able to identify, understand, and utilize that information. So the 3 things that I chose is number 1, safety and infection control. So the way that will be sought out through the information from the NCSBN is to verify orders, medication amounts, and other safety checks when caring for the patient, applying measures of infection control. So helping to know the high risk of infection that patients with diabetes have, assessing that risk with the patient, using safety measures to use your core process with correct labs, correct medications, following up on those medications and those orders, knowing what those medications are, if they're short-acting or long-acting insulin, and just implementing that into the care. The second one is health promotion and maintenance. So the way that this will be sought out in this curriculum is to educate and assess the patient's ability to care for themselves in the home environment. Educate patient on high-risk behaviors that may interfere with health and disease process. So that would come through assessing your patient, doing a thorough H&P, reading through physician's notes, reading through social worker notes, working with case management, and just working with the patient to identify these high-risk behaviors and to try and do education and provide written and verbal education to the patient in order to eradicate these behaviors so that the patient could improve their quality of life. And the final one is safe and effective care environment. So the way that this would be sought out is by delegating appropriately, locate and work within scopes of practice per state regulations, refer correct to multidisciplinary team members, and utilize resources effectively. So that would actually hit all of the objectives on 1, 2, and 3. And this really helps kind of solidify that concept of knowing your resources, knowing where that nurse practice act is and what your scope of care is, knowing where to find the institution's policies and procedures guidelines, who is on that multidisciplinary team, what are their strengths, how can they help you with this thorough management of your patient, and how to implement the interventions, education, and cares needed to correctly take care of this patient. So overall, this is the concept map in its entirety. This concept map started with the Healthy People 2030 disease process of diabetes. It looked at putting it in the course of the course of medical surgical care course for undergraduate baccalaureate students. And the 3 interventions are stated for the course. The way that those interventions are put into the curriculum is, and the tools used to implement these into the curriculum were the AACN, the QSEN, and the NCSBN competencies and tools. And I showed how each one implemented each objective and how that would be implemented. These are the references that I used. Thank you for listening to my presentation and have a good day.